Hello, and today we are talking Rogaine for female pattern hair loss. In the general scheme of female pattern hair loss and how we treat it, Rogaine is usually our go to and plus minus spironolactone at first. After that, if it doesn't work, there's a lot of possibilities, but Rogaine or topical minoxidil is usually our first go to. So, we are going to talk basics, the forms of minoxidil, its application, the side effects, brand names, does it actually work, and can you kick it up a notch? Now for the basics of Rogaine or topical minoxidil, which is the generic name of it. So, minoxidil started as a blood pressure medication, and there was a side effect that it grew your hair. And it's thought that maybe because it dilates your vessels, so it gives more growth factor to the hair follicle. And it's FDA approved to treat both male and female pattern hair loss. Now, how can you get minoxidil? It comes in a tablet, which is becoming more popular to take it orally, or it comes in foam or solution. Let's talk Rogaine specifically because that's the most common brand, and we'll talk women's versus men. So, both women's and men's, they both come in a foam and a solution form. The women's comes in a 5% foam that you use daily, and also a 2% solution that you use twice daily. In terms of the men's, there's a 5% foam, 5% solution, both of them twice daily. So when you're comparing treatments, well, first, one little tidbit is that if you're using the solution, one way to make it a bit easier is to buy one of those empty spray bottles and then pour it in, and you just spray where you have to, and it just makes it a lot easier. In terms of the foam, so there's a lot of controversy about Rogaine because of the pink tax. So for men, if you look on Amazon, three bottles of the Rogaine cost 47.08. The men or the women's, you can get two for $48, and they're both the same thing. Both 5% minoxidil topical aerosol, 60 grams. The only difference is the men says not for use by women. And if you look at the ingredients, you might think, oh, well, maybe they're a little different. That's why it's more expensive. No, they are exactly the same. So if you are a woman and you want to save some money, you can just use the men's Rogaine. And you might also be asking, well, the 2%, does that even work? And the 2%, actually, there are studies that show the 2% is about the same as 5%. And that was proven in randomized trials. The other thing you might say is that, well, my scalp is a sensitive girly. She can't tolerate a lot being on her. In that case, go with the foam because the foam is much more or much better for more sensitive scalps. So, for the application, when you apply the Rogaine, you apply it to the scalp, not the hair, and make sure you massage it in with your fingers and afterward wash your hands. As far as side effects, the biggest side effect that we worry about or tell patients about is the hair shedding for the first 2 to 8 weeks. We think of it as kind of resetting your hair follicles, so the hair will come back, but patients understandably get upset at the hair shedding. There might also be some itching or flaking, and you might also have hair growth on the face or body. And this is an example of a patient who had hypertrichosis, which is excessive hair on her forehead and her body due to topical minoxidil use. Some brand names. Obviously, Rogaine is the most popular. Generic is fine. You can buy the generic. Does it actually work? So, yes, it does. They're both systematic reviews and meta analysis that proves topical Rogaine does work, but you do need at least 4 to 6 months of daily use. So, it's not a very satisfying treatment because it's so slow. Can you kick it up a notch? And yes, you can. This was a paper that compared basically plain minoxidil use compared with PRP and microneedling, and do they work and how do they compare to each other? So these researchers studied 27 trials involving over 1,000 patients, and they found that hair density improved based on which type of treatment you were doing. So at first, or I should say, the most effective option they found was 5% minoxidil plus microneedling. And then actually, that's the most effective compared to 5% minoxidil just plain. So that was actually much more effective than the plain minoxidil. Another way you can kick it up a notch is by using both minoxidil and tretinoin together. And how does this work? It's thought that it increases the conversion rate of minoxidil to its active form, according to this paper. So, what does that mean? So, minoxidil by itself is inactive, it doesn't do anything. But when it gets down to the hair follicle, there's a certain enzyme that transfers a sulfate to it, and then it becomes the active form. And that's what can make your hair grow. If you add tretinoin to this, it makes that enzyme work even better. So you get even more of the active form. So that's why tretinoin and minoxidil, they do work well together. So what if you use topical minoxidil and it doesn't work for you? Well, we have a lot of options. There are many possibilities we can use. We can use finasteride, oral Rogaine PRP, laser light. There's a lot of things we can use. So if topical Rogaine isn't for you, there are other things that we can try. And that's all for today. Thanks for watching.